Superficial structure, of course, that's the nipple, right? Areola is the structure around that. We can then see our mammary gland right through here. But you can't actually see the lactiferous duct, which would be the little duct that's draining into the nipple for the milk to go. Now, right behind that would be the retromammary space. Now, you don't really see anything here, but this is where that space would be. Of course, pectoralis major, you have those two different heads though, right? So here we have the sternal head, right? We have our clavicular head because it's attaching through there. And if we look right through here, we can see this nice sort of triangular shape. That's our deltopectoral triangle that's created as the borders from the delta and the pectoralis right there. Deltoid muscle, pectoralis major. Between those two, right through there, that's where we have our cephalic vein, which is in our deltopectoral groove. Deltoid muscle, we can only see a part of it because we're using the high resolution, but of course it has the three different heads. And then we have the pec minor underneath. Remember, ribs 3, 4, 5, goes up to the coracoid process. Get rid of that. We can easily see our serratus anterior muscle right through there. And remember, we said we put salt on the chicken wings, serratus anterior, long thoracic nerve. The pathology would be wing scapula if there's a problem. And then I'm going to come back up to where our clavicle would be. Let's just put it on there. Okay. So we see our clavicle, and the muscle right underneath is our subclavius muscle. And we said the nerve that goes to that is the nerve to subclavius. So this empty space right there, I was like, I'm missing something. I don't know what it is. This is the intercostal muscles. Remember that our external intercostal muscles are going to go in this direction, just like we're putting our hands in the pocket, and they're also going to stop a couple centimeters. This looks bigger because it's magnified, but it's normally going to be about 2 centimeters from the sternum. And the internal intercostal muscles start all the way from the sternum, and they go in the opposite direction. And then they cross over behind. All right. The transversus thoracicis is one that we can't actually see on the cadaver. The subcostalis, it doesn't have your subcostalis. We'll only see that one on our models. And diaphragm, big muscle, right? We can see it right through there. We turn it down and we look at the top. All of this right through there is our central tendon. All of this is our central tendon, and all of this is the muscle. All the reddish portion is the muscle. And that's a little bit easier to see if we look at the model. Okay, nerves. And let's just look at the intercostal nerves. So I'll just put that one right through there. Let's put the skeletal system back on so you can see it in contact. So we can see the intercostal nerve as it's going through there.
I think it's actually worse.
There's a lot of through there. Of course, that's happening in all the different spaces or intercostal spaces. It's coming off the ventral root. So if you follow it all the way back to where it's coming from, you can see it from the ventral roots. And we can see it kind of popping out right through there. So intercostal nerve, let's take a look at our vagus nerve. So if we start off by just looking at our right and left. So if we start off here, we can see our right and left vagus nerves. The bones back there again. So let's get rid of the rib cage. Okay, and if we turn it sideways, we can see the vagus nerve coming out through there. Remember, we said that the vagus nerve travels with the carotid artery. So if we look up here at the very top, we can see right beside the common carotid, that's where we see the vagus. But we also said that the vagus nerve is also going to come back and turn into the recurrent laryngeal nerve. We said on the right side, it's going to cut under our subclavian artery. Okay. So again, if we blow it up just a little bit more, we can see it pretty easy. So vagus nerve continues through here, but the branch that goes here and would be going under the subclavian artery and going back up to the larynx is the right recurrent laryngeal. Remember, down here is where we would see the arch of aorta, right? So right through there, turn it sideways, and now we can see it going under the arch of aorta and then going back up to the larynx itself. So that's our left recurrent laryngeal nerve. So the vagus nerve, again, is the wanderer. It's going to continue to wander through all of our viscera. And the tissue that would be right here is our esophagus, and we can add that in just so we can see it. Our table says that this is the esophageal plexus, which is technically true, but remember, if it's anterior, it's anterior esophageal plexus. If it's on the posterior aspect of the esophagus, then it's posterior esophageal plexus. Let's add the esophagus just so we can see. So technically here in the front, we would say anterior. And then technically in the back, we would say posterior esophageal plexus, or you could say posterior vagal trunk. And on the exam, you can also move the table like this, so you'll be able to see what's posterior and what's anterior. The cardiac plexus, let's see that. So you see this big bundle of vessels right through there. It's really showing up kind of where the pulmonary trunk is and where you have the aorta. But it's still the cardiac plexus, even though it's not necessarily like right on top of the heart. So if we add the heart in, through there, we can see it's like around where these vessels are. But of course in the real cadaver, it would actually be kind of flowing out to other sections as well too. And if we traced it back, we would see it coming back from the vagus nerve itself, given those contributions. Phrenic nerve, we always say phrenic nerve, 3, 4, 5, keeps the diaphragm alive, right? So if we look at the phrenic nerve in this position, we can see it traveling right around here. Remember where it touches the pericardial sac or the pericardium, it changes name to the pericardio-phrenic nerve. But as we see it down here, this is where it would be on top of the diaphragm, and that's going to be our phrenic nerve again. So phrenic nerve here, and we find it on top of the anterior scalenes, pericardiophrenic, and then the phrenic nerve again as it touches the diaphragm. Right and left thoracic ganglia, right through there. Okay, we can see those are anterior, lateral, the vertebra. And then we can see the splanchnic nerves, and I just added the ones on the right. So if we look through here, we can see 1, 2, 3, 4 nerves all come together to create the greater splanchnic nerve here. Okay. We can see 1, 2 coming together, and that's going to give us our lesser splanchnic nerve right there. And then we can see one individual, which is going to be our least splanchnic nerve right there. And that's where I would tag it down here, where we see it all coming together. That way there's no confusion. Subclavian artery, vein. Let's go ahead and look at the internal thoracic vessel. Put it in anatomical position. Looking like that, it looks like nothing, so let's add the skeleton back onto it. So if we blow this up so that we can see it, internal thoracic artery and vein both have the same name. Okay?
That was disturbing.
So remember, as we see it here, this internal thoracic, it's right behind the anterior portion of our ribs.
Yeah.
But then we said it's also going to continue down, right? We said as it goes down into the abdomen, it becomes the superior epigastric, and it could be artery or vein. Just depends on which one we're looking at. And then we said it also goes this way and becomes the musculophrenic artery or vein. So this is the superior epigastric artery. This one here is the internal thoracic artery. So this is actually the vein. It's the vein or the artery. Remember that coming off of this, you have your anterior intercostal artery. So in the front, we have our anterior intercostal artery that's coming off there. The posterior intercostal artery comes off of the descending aorta. The subclavian artery and vein. Put on our great vessels. What we don't see, but can see, is the superior vena cava. I'm going to get rid of these tissues so we can see the other stuff we want to see. Okay, so we see when it's one combined thing, this is the superior vena cava, but the two immediate structures feeding into it are our left and right brachiocephalic vein. All right, so as this continues up, so superior vena cava, brachiocephalic, then we come to our internal jugular vein, and then we come to our subclavian vein. I'm going to go ahead and get rid of these ribs. So remember we said on the right side, so if we take this like this, it's kind of hard to see, so I'm going to remove these blood vessels. Okay, so you see this arch right through here. You see how it's dumping into the superior vena cava. That's not on your list, so I wouldn't ask you that, but just so you can see it. On the right side of the body, we have the azygos vein.
Yeah, it's the same.
On the superior left side, you have your accessory hemiazygos. On your inferior left side, you have your hemiazygos. Now remember, where they join the azygos can vary. And sometimes these two even connect together and then they join as one structure. So you just have to kind of look at the different cadavers and see which ones are which. So it's better just to remember on the right side, azygos, left side, inferior, hemi, left side, superior is going to be your accessory hemiazygos. We weren't able to see the superior epigastric artery in the vein. We've already seen the musculophrenic. The aorta. Here you have your ascending aorta, arch of aorta, and then I have gotten rid of the descending aorta. Here. Okay, so descending aorta, arch of aorta, ascending aorta. Now remember, you have these three branches that are coming off right through there. 1, 2, 3. Remember, the 1 is going to go and become the brachiocephalic, and then it's going to branch and become the common carotid, and then continue on this way as the subclavian artery. But remember, on the left side, the second branch here is going to be common carotid, which will then branch and go external and internal. And then this guy is going to be our subclavian right through there.
Yeah.
Remember, we weren't able to see the esophageal arteries, but remember, if you see an artery on the esophagus, esophageal artery. The bronchial artery, we were able to see that, but remember I told you I'd show it to you with the bronchioles. So you'll see it feeding into the bronchioles. Posterior intercostal arteries, if we look here, you see the holes right there? That hole right there, that hole right there, the hole right there. What's coming off there, they feed here. These are the posterior intercostal arteries. So remember, we said the anterior intercostal artery comes off the internal thoracic, but the posterior intercostal arteries actually come off the descending aorta. Okay, so you have to call them a different name at the different locations. We don't see the superior phrenic artery on the anatomage table, the pulmonary trunk. Let's get rid of the fat. Remember, that's all fat. Okay, and now we can see our pulmonary trunk. Remember, the pulmonary trunk is coming from our right ventricle, carrying deoxygenated blood up through here. And then it's going to give us the pulmonary arteries. Let's color it blue because it's going to be blue, right? That do this. So let's pull up our pulmonary artery. We can see those off the pulmonary trunk feeding into the lungs, carrying the deoxygenated blood to have gas exchange happen across the alveoli, and then come back in via the pulmonary veins. The pulmonary veins, we can see them right there. It's feeding in this hole right through there. We put it in here. We'll blow it up. I'm going to get rid of this ventricle so we can see behind it. Okay. Now, the pulmonary veins are going to come back into the left atrium, right? So if I get rid of that, it'll get rid of everything. But as I rotate it around, and we get rid of this guy, get rid of that, and I tag that. Then we come to the pulmonary artery, the pulmonary vein, the left atrium. It's right there. So remember, the big key is that it's going to be going into the left atrium. That's how you keep it straight. You don't mess it up. The pulmonary artery is going away to the lungs. Pulmonary vein is coming back to the left atrium and bringing the oxygenated blood to circulate it the rest of the way. We didn't see the ligamentum arteriosum, which we were all sad about. All right, so we've got this here. So now we're looking at our trachea. Remember, you have your cricoid cartilage. That's what these little semicircular rings are. The carina is the very last cartilage here. We can kind of see the outline of a V shape right through here, and it's got the arrow pointing at it. At that point, we divide into our primary bronchi, so primary bronchi. And then where it divides again here is our secondary bronchi and secondary bronchi over here. So I believe that's everything on our list.